Hey, good morning. We're going to do your cervical traction session today.
Okay.
We got the equipment laid out. This is going to be the equipment that you'll lay out at home for yourself.
Okay.
We've got our Saunders home traction unit. I want you to have it on a firm surface, so a firm mattress or perhaps down on the floor.
Okay.
And a footstool, so which you're going to need to go under your legs. You're going to need a couple of paper towels to place for just some hygiene, a timer so we don't fall asleep and are on traction too long,
Okay.
and then also probably a call system. So if you're having a problem, you can alert someone either in the clinic or in your home that you're uncomfortable or maybe that you need a little help getting in or out of the position.
Okay.
All right, so I'm gonna check your skin real quick because this is gonna have direct contact. We're going to make contact at the posterior neck. It's gonna catch your suboccipital area. And then we're also gonna have a strap that's gonna come across your forehead. So I'm just looking to make sure your skin is intact. We have a good capillary refill, and can you feel me touching your neck?
Yes.
Yeah, and what temperature are my fingers?
1.
Perfect, I'm gonna touch your forehead. Good, and we may wanna take your glasses off.
Okay.
We can just put those aside.
Okay.
I'm gonna have you kind of sit up on the table, and then we're gonna lay back into the traction unit.
Okay.
And I've already got some paper towels down.
Okay.
And let's scoot down a little bit more. Perfect. Right into the cradle. Good. And I'm gonna reach across you. Is this comfortable?
Mm-hmm.
Good. Okay. Paper towel's just gonna go across your forehead.
Okay.
And what I'm going to have you do is reach back and grab the strap that's gonna go over your forehead. So right about here. And we're just gonna go over your forehead. And then if you reach down the strap, you're gonna feel the Velcro strap. It's a little triangle.
Oh, there.
Perfect. And there's one on each side. And one on this side. There you go. Nice. Needs to be snug, but not tight.
Okay.
And that is why I asked you some of those safety questions, like were you claustrophobic? You told me no. Being that this is going to be very snug around your head, and it's also going to be snug around your neck. Sometimes patients that are claustrophobic, this makes them really uncomfortable.
Okay.
The fit around your neck is adjustable depending on the size of your neck.
Mm-hmm.
There are some adjustment scroll bars, so I'm going to take your hand and have you just reach back. And there's one on the opposite side as well. And just very gently as you roll it, you're going to notice it either will start to take it in or to widen it out.
Okay.
I think it's in the widest position when we started. So it should kind of just be a gentle squeeze or hug around your neck. It should not be tight. And then once we get going, if it is uncomfortable, we can adjust it. The other thing that I asked you to do was to remove your dangly earrings. So we'd want to absolutely make sure nothing's going to get caught.
Mm-hmm.
And I love that you wore your hair up today because that's the other thing that can kind of get caught in the track is your hair.
Okay.
Perfect. Okay, so I'm going to reach around you and we're going to make sure that we set a timer. For today's session, we're just going to go for a 5 minute. And also your call system. These things should be kind of reachable, so making sure they're kind of down by your hip. Both of these things are reachable when you need them.
Okay.
And then the last thing is going to be the gauge. This is a pneumatic pump, and it has the ability to pump, hold, and release.
Okay.
Right now it's in the middle section, which is pump. We can rotate it one direction, and once we pump, it'll hold it so the chamber doesn't lose air. And then when we're ready for you to come down out of traction, we'll turn it to the release position, and it'll slowly lower you down as the air eradicates out of the air chamber.
Okay.
Do you see both red and black numbers?
Yes.
Perfect. Okay. So the red numbers is in kilograms, metric, and the black numbers are in pounds.
Okay.
What we finished doing over on the clinic-based table is that we had gotten you up to 20 pounds a pull.
Okay.
So that's what I would like for you to try today. And then we'll start with 5 minutes, and then progressively every visit or every time you use it at home, which will be daily, we'll add 2 to 3 minutes. I just want to make sure as we switch from a traction table in the clinic to a home unit, we start with metrics that aren't going to flare your symptoms.
Okay.
Okay. Last couple of things. At the beginning of the session, I asked you about numbness and tingles to rate it. We talked about rating your headache. We talked about rating your pain level. We discussed that you weren't having any new or different symptoms. And we discussed that currently you don't feel nauseous and you're not seeing any sort of spots or lightheadedness.
Correct.
If any of those type of symptoms start, or if you're having them and they get significantly worse, then that would be a reason to conclude the traction session and probably get a hold of me so that we can have a discussion on why is this different than maybe what the response we got in the clinic.
Okay.
All right. Okay, so it's currently in the pump setting.
Okay.
You're gonna hold the gauge, watch the gauge as you do kind of a push and pull of the lever on this side. And you're gonna see the gauge, move, but you're also gonna feel the tracking system pull up.
Yep.
You there?
Sure.
Good. Okay, so I'm gonna have you rotate it, and very quickly we're gonna know if when you turn this knob, if it takes us into, oh, that was release. Okay, so it's a really slow, simple release.
Gotcha.
We're gonna go back to pump,
Okay.
and then after we pump, we're gonna turn the opposite direction, and that will be our hold position. Nice.
And now we turn the opposite direction.
Yeah, turn the, I think, gauge towards me. There we go, perfect. And then you're just gonna put the gauge kind of down on your abdomen.
Okay.
And then for this next, we'll start the timer. For this 5 to 10 minute session we're starting with, I would want you just to relax, right? I wouldn't want you reading, holding anything kind of up in the air. I wouldn't want you on your phone, just because I want the muscles around your shoulders and neck to just absolutely relax and enjoy the stretch.
Okay.
Last thing is this traction unit has 3 settings. We currently are at 0 degree of angle,
Okay.
which is appropriate for your condition. Because we needed to kind of target where you're getting those headaches at your suboccipital range, and also kind of those upper C3-4 segment. If you had a different type of condition, maybe like a herniated disc at C5, C6, C7, we definitely would adjust the unit at the most angle, which would be 25 to 30 degrees. And then if you just had maybe had a motor vehicle accident and we wanted a nice stretch along the chain of the cervical spine, we would put it at the 20 degree angle, and you'd get kind of a nice pull along the entire musculature and ligaments of the cervical spine.
Okay.
But 0 degrees is appropriate for you today. So just know if you were to make an adjustment or you see that it's been moved, we want you at this lowest setting.
Okay.
All right?
Great.
Any questions?
No, ma'am.
All right.
Thank you.
Thank you.